When we think about really focusing on health equity, we have to look at the upstream drivers of some of the clinical outcomes that we see in our hospital. Boston Medical Center is a hospital that serves communities that have been affected by redlining and have been disinvested in when it comes to housing, workforce development, and education. All of those things affect clinical outcomes. Oftentimes, people ask us, why is it so important for a hospital to really be engaged in economic mobility? Economic mobility is a true social determinant of health.
Economic mobility is a powerful engine for an individual to be able to thrive in our society. BOSS Collaborative is a community-driven initiative birthed out of Boston Medical Center, and one of our primary goals is opening pathways to employment and professional advancement for our community members.
We know that if we can provide on-ramps and opportunities, make sure that there is workforce development where there's training so they have access to jobs in biotech, in healthcare, in blue-green jobs, the long term is seeing a transformational change. An example of how we're trying to do this in our own workforce is by providing upskill training and access to leadership opportunities. Monica Germain is a great example of how this approach is having a lasting impact.
I am first generation. I speak Haitian Creole, and I knew that right out of nursing school, I wanted to work in a place that I'd be comfortable. I also wanted to work in a place that had patients as well as colleagues that looked just like me. I started here on like a med-surg floor and then transitioned to the ICU, which was amazing. You know, I was able to gain all these clinical skills, but I felt like I was still missing a piece. I was still searching for more, if that makes sense. There was a chance to apply for a health equity fellowship, and I applied and got accepted to the program. So right now I'm in this fellowship and working differently with patients. I feel that now I look through things with an equity lens. I'm able to be in spaces with leaders and have conversations about structural and institutional racism and how that affects our patients.
Another area we're focusing on is neighborhood revitalization, particularly investing in Black and Brown-owned businesses. Nubian Markets, which is located right in the heart of Roxbury, is one of those businesses.
Nubian Market is basically a celebration of the African diaspora through food. It's a place where people come, gather, shop, and celebrate, our culture. It's been a sense of pride for the community because they can see themselves in as they love the experience of having a dignified shopping experience. And of course, the products and services we give here are unique.
We not only created a pathway to ownership for the founders of Nubian Markets, we also connected them to additional funders, guided their communications and engagement strategies, and advised them on how to hire locally.
Almost half of our staff comes immediately from this vicinity, and they live and work here. The relationship that we have with Boston Medical Center and BOSS Collaborative is one that we cherish very highly.
We're thinking about community and our residents from a long-term sustainability approach. We are moving beyond the status quo and doing the work to create a community that we can be proud of and our patients can thrive in now, as well as 20 to 30 years down the line.
We're moving beyond just the clinical. Of course, we're a hospital and we're treating diabetes and cancer and all of those things, but we're also looking at patients in a 360-degree model, making sure that we understand what they need.
Our future plan for Nubian Markets is to abolish food deserts, whether in our city or in the nation. We want to make sure that other communities have the same opportunity for fresh food.
We are creating a seat at the table where no seat has existed before. We are giving a voice to people who are deserving. There is no greater reward than working at an institution that is committed to that on a daily basis.